My name is Dr. Hillel Mazansky. My areas of expertise are medical hypnotherapy, guided visualization, nutrition and exercise, how to live a longer, happier, healthier life, my mantra. Today's health tip is entitled Pre-Operative and Pre-Medical Diagnostic Procedures, Fear and Anxiety Removal. There is no one that I know of when they are scheduled for major abdominal or other type surgery that do not have an inherent fear and anxiety as to the outcome of the procedures or the surgery, whether it be by a general surgeon or a OB/GYN or whatever type of surgery, neurosurgeon, any type of surgical procedure. There is an inherent fear and anxiety attached to having the procedure, and it is the anticipation of having the procedure that is so anxiety-provoking. How about if one could treat or prevent that fear and anxiety, not by taking medication such as Valium or Xanax or any one of those, all of which have toxic side effects and are addictive? How about if one uses medical hypnosis and guided visualization to prevent such a fear of having to undergo surgery? It is also not so much the fear of the surgical procedure itself, but as patients have related to me, "Doctor, will I wake up?" Having undergone major surgery in 1985 for metastatic testicular cancer, the same as Lance Armstrong, except in my case, it didn't go to my brain. My hypnotherapist back in Cleveland, Ohio, empowered me to help myself remove the fear and anxiety associated with a 12-hour operative procedure. If I could do it, folks, so can you. It is so simple and so easy. On my website, drmedicalhypnosis.com, is a video described exactly for pre-operative anxiety treatment using a brain massage. Now you'll say, a what? Well, yes, because one all knows what a body massage is. No one knows about a brain massage, which I have coined the word of a brain massage. There is no clinical psychotherapist that could guide you or will be able to hypnotize you in medical procedures and surgery like a physician can, no matter how good they are, and there are some that are extremely good. But such as myself, in a previous life, when I practiced a lot of surgery, GYN surgery, etc., I knew what the patients used to come and tell me prior to the procedure. Even to have a simple thing as a tonsillectomy, they were anxious. There was fear. You could detect it in their voice, because not of the procedure itself, but because, will I wake up, doctor? In other words, from the anesthesia. That is the most fear-provoking situation, is the fear that they will not wake up after they've been, quote, put to sleep, close quotes. Medical procedures can also be extremely fear and anxiety evoking. Whether they are operative or non-operative, it makes no difference. an actual fear and anxiety for MRIs. It's a specialized X-ray technique, if you will, where the patient is placed in a very confined position and the noise of the machine is unbearable. People fear being closed up. They feel as if they're in a coffin. Can you imagine now if anyone is claustrophobic? They refuse to have that procedure done. Know how much Valium they take and how much Xanax they take. They will not go into that MRI. This led to the development of what is called an open MRI, where you are not confined to an area, but those open MRIs are far and few between, and they cost double the amount of a regular MRI, which today in California is anywhere between $3,000 and $6,000. An inexpensive way, my friends, to help yourself reduce your fear and anxiety for any surgical or medical procedure. How about if I offer you medical hypnosis and hypnotherapy? You download the video from my site, drmedicalhypnosis.com. You place it onto your cell phone or handheld device. You start listening to it about a week before the procedure or the surgery. And in actual fact, I've had patients take it into the surgery itself so that they can listen while they're waiting to go into the operating room, or while they're waiting in the waiting room. Instead of watching TV or reading a trash magazine, they listen to the hypnosis video, that by the time they come to the surgery or have the medical procedure, the brain massage, they are totally relaxed. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.